I'm jumping on today because I am going to interview Alysia Tucker. So Alysia Tucker is a doula in the city of Pittsburgh. That's where we are. We're in Pittsburgh, Pennsylvania. And she's just going to talk to us about what a doula does, how can they support our community, because doulas, we all think about, okay, they support um, I'm having a brain fart. They support the midwife, but they do so much more. I've seen them used in our Pittsburgh public schools where our students who are young and they um, have a doula as a support system. That would be great. So I see she's on here. Just send me a request because I don't know how to send it to you. Let's see. Can I send it to you? Oh, there we go. Did you get the request, Alysia?
Oh,
Hi,
so cool. Hey.
So I was just talking about how, can you see me all the way? Because I'm not a production person.
So below your nose. Oh, there you are. Now you're perfect.
Is that better?
Perfect.
Okay.
Mm-hmm. Oh my goodness, you look like my cousin. I'm gonna have to send you a picture.
My cousin?
Yeah, right. Probably.
So I just wanted to jump on because I really feel like there's a misunderstanding of doulas, right?
Mm-hmm.
And even myself as a nurse practitioner, I don't know all of the roles a doula holds. Plus,
Mm-hmm.
when you sent me the information about doulas, postpartum doulas, like
Mm-hmm.
I didn't know that. So let's just start with, hi,
Hi.
how are you, Alysia? And what do you do as far as working as a doula?
Sure. So let me to back up,
Okay.
because I kind of caught the tail end of everything you were saying, and so I kind of want to piggyback off of that for the people that were listening.
Okay.
So really, a doula is there as a support person, and the role of the doula, that name doula kind of came around maybe in the 60s. It's a Greek word, and basically it's just someone that's present. So when we're in a birthing space, really the mom, that's our client. That's who we are there to support. You're there to support the whole family, but really, mom is like the center of our work. And so we don't provide any type of medical care. And I wanted to make that really clear because a lot of people get us confused with midwives.
Mm-hmm.
And so midwives catch babies, they're in there, they have that medical background, but we don't. We really provide that emotional support. We provide education. So once a mom is connected to our services, then we're going to create a birth plan for her.
Let me ask you a question real quick.
Sure.
Does the patient have to see a midwife to get a doula?
No.
Another
No.
misconception.
Yeah, so actually the births that I've done have been with OBGYNs at the hospital. So and there's also another myth that doulas only work with moms who want a unmedicated birth. But actually, like, I've done a birth for a C-section and supported that mom. I've been in births where mom's like, I want epidural. That's my birth plan. How can you support me in that journey? So we use a lot of like natural techniques. So pressure points, relaxation techniques with massage to really just kind of calm mom and help her work through her labor and delivery. So I'm a birth doula, and as you alluded to, there are postpartum doulas.
Yes.
And
I want to get to that later.
Okay.
Because that amazed me. Like, I just want people to know, like, you sent me a lot of good resources, a lot of good information, and I started posting it in our elite group. We have an elite group of nurses and nurse practitioners, and I just wanted to make sure that we are really educated because mortality among African American babies and mothers are really high, and in Pittsburgh. Correct? You know the percentage?
So I don't know the data for maternal mortality here in Pittsburgh, but Black babies, the infant mortality rate, which means how many live births, how many deaths per 1,000 live births for Black babies is 13.75. So it has decreased in the last 20 years, but we've been kind of stagnant at 13. And then nationally, the Healthy People 2020 goals, those are the people that look at population health and come up with statistics and kind of like a report card of where you should be based on your size and etc. Their goal is 6.0 for as an not acceptable, but you understand in a population that some infants may pass. You don't want any babies to die, but we're talking about those deaths that are preventable. So deaths due to preterm birth, women who aren't going all the way to full term, those types of deaths, we really want to reduce it. So it is a disparity here in Allegheny County, and there's a lot of efforts to reduce it. And I think doulas is just one. I think that working with nurses, midwives, with physicians, social services, all of us together really are a team that can support moms during their pregnancy.
So do you see a lot of parents? Well, let me first ask, what is the education required to be a doula?
So there's the biggest, I guess, most reputable doula training program is called DONA, and that's Doulas of North America, although it is an international program. And that's a three-day intensive training. And then from there, you're considered like a doula in training. So you then have to have a childbirthing education class. You have to have like a Lamaze class, a breastfeeding course, to then kind of just get those additional tools in your toolbox. And so then you can start assisting women with births. And then there's other steps to become certified as a DONA doula.
So are you certified?
No, I'm in the process. I have to finish some of my paperwork. So I've had more than the number of recommended births. There's a lot of readings you have to do to be certified. I am a certified lactation counselor, which is separate. So I'm just finishing up that paperwork now so that I can get certified as a doula, birth doula.
Okay.